Even with small reminders around, like this tiny tree or these shiny baubles, it's easy to forget about the holidays. Instead, Tasleen Nimji and her staff are preoccupied, preparing for another wave.
Time is not on our side here with how quickly Omicron is spreading.
On the front lines, that means workers reaching for N95s over surgical masks again. Nerves here are shot. People are simply exhausted.
We're already dealing with staff shortages and high volumes. And so that's a challenging environment to work in. And now you're layering this on top of that.
Critical care capacity is likely to be tested once more. That work is some of a hospital's most demanding under normal circumstances. And just one new Omicron case among staff could force entire units into isolation.
We might be looking at nursing ratios that need to be 1-3, 1-4. And that brings up its own issues in terms of how do we keep everybody safe.
Frontline workers have seen this before. Hospitals in Alberta and Saskatchewan buckled under the strain of the third wave. Provinces like Manitoba have already asked Ottawa to send help, more ICU nurses, knowing what could happen if an outbreak occurred. At Toronto's Mount Sinai Hospital, nurse Sarah Beth Silver works with some of the most vulnerable, cancer patients. She knows she has to do everything she can to stay healthy, washing her hands, wearing masks, minimizing contacts, and getting boosted.
I think we're taking the lessons that we've learned from the first few waves of the pandemic to take it into this next phase.
Nimji says her teams are ready to borrow staff from other units and transfer patients if need be.
It's hard, but we have to do it. We got to do it.
Left with the hope Canadians will get their third doses to help those who are committed to helping us. Jamie Mauracher, Global News, Toronto.